We've got Dr. Hildegardt Raubenheimer with us today from Aesthetics Artistry Aligned, and we're very excited to have you today. And I want to just hand over to you for a brief introduction, but welcome.
Thank you so much, Kat. Thank you for the invitation. And yeah, thank you for having me. I'm Dr. Hilla, shortly known as Dr. Hilla, but I am Dr. Hildegardt Raubenheimer. I am a medical doctor by profession. Most of my career I've worked in general medicine and emergency medicine, but then decided I am going to venture into aesthetics about 8 years ago. And I opened my business in Cape Town in 2019. My practice is called Aesthetics Artistry Aligned, and our focus is mostly facial and body aesthetics, where we focus mostly on undetectable aesthetics, as well as a little bit of body aesthetics, medical weight loss, and a big focus in my clinic is on skincare, a little bit of regenerative medicine as well. So overall, it is to take care of the wellness and the beauty of the face and the body as we age in a healthy way.
Fantastic. Okay, so let's dive in. Let's discuss with assessing the skin. What specific things will you look at when doing an assessment?
Okay, so skin, as you know, is quite an intricate organ. It's the biggest organ in the body. There is a huge communication that happens not just outside on the skin, but there's lots on the internal side that also contributes to what we see on the skin. But just from an aesthetic point of view, what we would normally look at is things like your skin radiance, your laxity, whether you have sagginess, whether you have dullness. We look at your hydration, we look at your fine lines and wrinkles, pigmentation, just the overall health of the skin. And then, of course, we delve a little bit deeper when it comes to the sicker skins, because we see a lot of sicker skins with compromised skin barrier and rosacea, acne, pigmentation, melasma. Those are the kind of patients that we also often treat in clinic that needs a little bit of a long-term approach and also a medical approach. Yeah, so basically when it comes to skincare, we look at the aesthetic and what we see in the mirror and the skin problems that we see in the mirror, but we also look internally at what might be contributing to what we are seeing and experiencing in the mirror. And yeah, so that's why skincare is not only topical and about, topical treatments and injectables, but also really having an holistic approach to what contributes to skin health.
That makes so much sense. Okay, how does the structure of the face age?
Okay, I love that question because, I often have patients telling me when they walk through the door, "Doctor, I'm worried about this line that I'm seeing over here," or the nasal labials are coming to show all of a sudden in my 30s, and this is starting to show, and my eyes hollowing, and what can I do for my skin to improve this? But it's actually not really a skin issue, because what we see in the mirror, like we think we only see skin, but we are so much more than that. When you look at the face has so many structures underneath the skin. There is the skin, then there's superficial fat, then there's muscle and deep fat and bone, and in certain areas so many other layers. So anatomical knowledge of the face is very important when it comes to aesthetic medicine, and very intricate as well. So when we talk about structural changes and we refer to structural changes, we refer to not only the skin changing, its structure of the skin changes, yes, but we also refer to those underlying layers of the skin that ages in certain areas. And I make an example. For instance, when we get older, our skull, our bony structure, which is like the foundation of our face, gets smaller. Even though our overlying tissue, which is considered to be, your skin, your fat, and the muscles, still remain more or less the same size, but the skull changes. That's, for instance, a good example of one of the structures that ages as we go through the decades. This is a very slow process, but it's kind of predictable. You can tell what's going to age in your 30s, what's going to age in your 40s, what's going to age in your 50s. And that's why we have a different approach for when you're in your 20s, your 30s, your 40s, and your 50s. because we have to treat the aging structure, not just the skin, if that makes sense. I hope that makes sense. Yeah. So this is why aesthetic medicine and an aesthetic medical approach, or even if somebody doesn't know where to start, it's to start with a consultation so that your doctor can primarily assess where is the primary aging actually happen at. It's like you're going to the doctor, for instance, and you say, well, doctor, I have this headache that's not going away. The doctor is not going to just give you a Panado and treat your headache. We need to find out where is the underlying problem and what is the underlying root of why you are seeing what you are seeing in your face. And when it comes to structure, underlying structure, that is where we start, and that is where the conversation, the clinical conversation and assessment starts. It's important to then realize that it's not just, we can't just treat everything the same, because everybody ages differently and different structures in the face ages differently. We can't just treat everybody the same because everybody's structures ages differently. And this is where an individualized, sort of holistic, individualized approach is it's absolutely critical if you want to have good aesthetic outcomes in this kind of field.
Yes, more tailored.
100%.
Okay, perfect. So we obviously know the main factors that affect the skin, but what affects the skin the most as we age?
I would say environmental stresses. Definitely, we live in South Africa. We have such a lot of sun exposure. And if there's anything, the number one thing that we have to teach our children already from small age is that, and I think it's the best anti-aging ingredient, is to just commit to using a simple sunscreen. If you're lazy to take care of your skin, but use a simple sunscreen, not only for the days that you go to the beach or on a hike, but every single day, because we have so much UVA, UVB around us, but we also have other factors around us like invisible light, blue lights these days. Even sitting in front of your computer like you do now has high energy visible light, blue light. When you lie at night on the phone and you can see that reflection of that blue light on your skin, all of that oxidative stress within the skin. And then of course pollutants in the air causes oxidative stress, DNA damage to the cells in the skin. So there's that, a lot of environmental stresses, and of course it is also related to a lot of what I say, internal things like inflammation, gut issues, etc., without getting too technical. But those are the things that definitely environmental stresses. The sun plays a big role, and of course also intrinsic factors like we are all genetically different. We age differently. Intrinsically we are prone to, so some people might be prone to thinning skin very early in their life. Others might have a nice thick skin until later in their life, but then they start to sag a little bit. And for me, for instance, I have done my genetic testing and I am very prone to inflammation and pigmentation. All those kind of things play a role, but most of it has to do with internally, whatever can cause inflammation within your body, as well as externally, whatever can cause inflammation within your body, and that it comes down to external factors, environmental factors. Yeah.
What are the biggest misconceptions when it comes to skin or looking after skin?
Yeah, I think in your youth you're blessed, right? I would almost want to say that right now the misconceptions for me is that the more you do, the better for you amongst the younger generation. I don't think that's necessarily true. I think if you are young, you still have youth on your side, you have good collagen, you have good elastin. All that you need to do is protect your skin. Is protect that good collagen that you have. You don't need to do a lot of injectables, a lot of toxins and all of that kind of thing. You really, when you're in your and when you can really just have a good skincare routine. Of course, commit to using a good sunscreen, and then keep your skin routine very basic. There's ways that we can teach you how we keep it very simple, and a lot of it you can do at home, and then you come into us to just give you a little boost here and there. But then when you're in your 30s, it changes, right? So in your 30s I don't need sunscreen. the sunscreen thing for me is a big thing. It's like some people just don't believe that they need sunscreen, and I think it's the most simplest thing that you can do, especially for men. They just don't believe in sunscreen. It's the simplest thing that you can do to really prevent aging. I mean, they've done a beautiful twin studies where they basically have one twin just using sunscreen and the other one that doesn't use sunscreen, and you look at them 2 decades later, and you can see just by using that simple thing like sunscreen, you know, you
The
have a
difference.
world of a difference. Yeah. So misconceptions is yeah. So again, in your 20s, you don't need to do much. It doesn't have to be complicated. Simple things. It doesn't have to be a 10-step program. Some people really enjoy doing the whole,
Ritual.
the ritual of skincare, which I personally, I'm one of them. But some days it doesn't allow me to. But just to keep it simple, and it doesn't have to be complicated, as long as you are educated and understand what you're doing and you're not doing too much damage to your skin. Because for me, there's too much right now misconceptions spread by influencers, especially on TikTok, where they tell you to there's this and this and this, and we have teenagers already wanting to use retinol on their skin, which is absolutely necessary. Misconceptions. Let's see, sunscreens, oversensitizing your skin by making your skincare regime so complicated, and what else? And that that your diet doesn't play a role. Your diet absolutely plays a role in how your skin will appear, right? Holistically, again, once again, it all comes from taking care of yourself from the inside out. Yeah, yeah. There's more, and I can carry on whole day talking about inflammation and aging and how that goes hand in hand. But misconceptions, those are the ones I would say. The two top ones for me is people not seeing the need for using sunscreen, and the second one is it's either you do too little with your sunscreen or you do too much. And this is the thing where it needs to be, you do too much. You don't have to do too much. You can really simplify it in a healthy way. Yeah.
Fantastic. In your opinion, what 3 areas are non-negotiables in terms of skincare maintenance? And I think sunscreen is definitely one of them.
Hydration, non-negotiable, is sunscreen. Hydration, even in patients that feel that they have acne and they're oily and they still need hydration. And then later on, I think one of the best anti-aging ingredients would be something like a retinol or a retinoid, but then you have to be on your sunscreen, and you have to also then know how to introduce it gently so that you can be able to get the benefits. A lot of us are too aggressive, or I find that when you introduce something like a retinoid, there's something that we call a retinization phase. A retinization phase is where it's like going to the gym. You're going to the gym, and you don't go to the gym if you haven't been to the gym for like a year, picking up the heaviest weights. You go to the gym, you start light, you start gradual, and then you have your little muscular pain, you recover, and next time you're stronger. So the same thing happens with the retinol. With the retinol, you have to start slow, steady, and then increase as you go, as your skin gets conditioned. Yeah, it goes through a transition, and then it gets used to it, and it's usually within 3 or 4 weeks. Then you through that little that initial retinization phase. It helps to have guidance, like we are there to guide you, to help to introduce you in a healthy way without having too much uncomfortable effects from retinol. But those are the 3 things, I think. Hydration, sunscreen, and a retinol later. I also think a very valuable and underestimated ingredient that I think you can start using early on in your youth is an antioxidant. An antioxidant serum, like a vitamin C serum, it is so important, because once again, one of the things that I told you is one of the biggest aging components is oxidation in the skin. External factors is, so these antioxidants really help to fight off that oxidation. It prevents damage within the little skin cells, and it also helps prevent pigmentation, etc. So an antioxidant is also a wonderful thing to introduce early on. Yeah.
Okay, so we about to come out of summer, unfortunately, and a lot of us have a bit more sun damage and maybe pigmentation even. What is a good solution to deal with that?
Yeah. So even though we're coming out of summer, again, guys, we don't compromise on sunscreen. I think you need to continue using your sunscreen even in winter. We are going into winter now where we will have less exposure to the elements, right? So we're not going to be so outdoorsy anymore, and maybe not have as harsh sun exposure anymore. So it's the ideal time, if you have pigmentation issues, to seek help and not try to self-medicate, because pigmentation is a difficult thing to get rid of. It takes a lot of TLC, and to go aggressive, to treat it aggressively, it can go both ways. If we cause too much, if we're too aggressive with pigmentation, then you, especially in the incorrect patient that is maybe a little bit too sensitive or has a lot of inflammation in the skin, or even have a darker skin tone, then you can cause more damage than you want if you go aggressively. So we believe in a very slow and steady approach when it comes to pigmentation throughout winter, where we help to lift that little pigment that you've now accumulated on the superficial layers of the skin, and we can lift and lighten it. And during winter, by the end of the winter, you'll be rid of it. But when it comes to the deeper pigmentations, like melasma, for instance, melasma is like a hormonal type of pigmentation that a lot of us see. It has this very typical pattern. You see it on the cheeks, you see it like on the sides. It almost looks like a mask that you have on your face. Those are deeper. Sorry, like you're pregnant.
When you're pregnant, you get the
100%, 100%. Pregnancy is one of the big causes of melasma or cloasma, as they say. So when it comes to that needs a little bit of a very slow and conservative approach, and it needs to be overseen by either a dermatologist or an aesthetic doctor with a lot of skin experience. So you come to us then, and what we'll then introduce you to is something called a melanin blocker, something that will just help to calm down that little cell that lays down that pigment in your skin. Okay, because that cell is, because we come out of summer, that cell in summer, because of the heat and the sun exposure and the all the elements and the sun, and it's just very active. So it's stimulated, and then it spews out this little pigment, and the pigment goes and it settles within the skin. But before it starts settling in the skin, we want to calm that cell down with these ingredients that we then use, and then slowly that will help to then lighten and brighten the pigment without it actually settling. My advice would be, do not wait too long, because when you wait too long with pigmentation, it gets a little bit tough to actually get rid of it. And coming out of summer, oh, I'm also sad that summer's ending, but in winter, we tend to dry. We tend to be very dry, and these days there's a big focus on skin boosters, skin hydration, skin quality. So this is also the perfect time for you to make sure that you give your skin that hydration from the inside. So we can drink water, we can hydrate from the inside, we can put on our moisturizer, but the moisturizer can only penetrate to so deep. But then that's where skin boosters come in, because remember, our skin has layers. It's superficial layer, then a deep layer, and then another deeper layer. So we want to target that deeper layer with skin boosters. That's where, when you would come into the practice, and then we would give you a skin booster or treatments that would then recommend, that would be going hand in hand with your goals.
It's one of my upcoming questions, actually, the skin
Is
boosters.
it? Yeah.
Okay, perfect. Okay, so we'll go deeper into that just now. What is your opinion on the importance, oh my goodness, this is a really important one, of doing your homework in terms of illegal or underqualified practitioners, or those using AI to promote treatments? I mean, I don't know how people can't tell the difference, but I suppose it can be very confusing.
Okay, so firstly, It's easy to do your homework if you're looking at somebody in South Africa. Firstly, all medical doctors or all aesthetic injectors in South Africa have to be either a doctor or a dentist that is registered with the Health Professions Council of South Africa, which is called the HPCSA. They have a website. If you open that website, it will say for the public. Okay, you click on that little drop down. It will allow you to search a particular practitioner's name, and in that drop down, then you will be able to see, is this a practitioner? Is this a person that is actively on the roll and registered with the Health Professions Council of South Africa? That's the first thing. The second thing is there are a few red flags and warning signs that you can spot easily on social media. Doctors will very happily if it's a doctor that is registered, they will happily provide you with their MP number, their practice number, their full name, their full address, their telephone number, etc. on Instagram. But the illegal ones, they tend to hide under an alias. So they tend to have an alias name, then they don't have their full name, last name, usually over there. It's either a doctor this, doctor that. They call themselves cosmetologists often. Now in South Africa, a cosmetologist, unfortunately, there is no such designation as a cosmetologist. It does not exist. There is nothing like a yeah, you're either a doctor, or you're a nurse, or you're a dentist, or you're a somatologist, or you're a skincare therapist. But there is no thing like a cosmetologist. So it's a very fancy made up name, but that is basically from a different country most of the time that is claiming to be something that they are not. They are not doctors. Doctors will also very rarely call themselves master injectors or master of this, master of that, and label different countries where they have worked. I'm just pointing out little pitfalls for you to be looking out for, red flags for people that could potentially be illegal. And then costs, I think, to be able to, what I found is when there was one particular costs, you should be able to go in for a consultation and a plan before they can quote you on anything. Okay, not just be quoted, because this is something that I've personally experienced, is where somebody had sent a message to one of these pages and said, I would like to know, I'd like to come and I'd like to come for treatment. How much is this going to cost me? Usually in my practice, we would invite you in for a consultation. We'd say, this is the consultation fee. Come, let's chat. This is the fees, and then we can work out a plan for you, and then you'll get your quote in practice. But in cases where you get on Instagram told, well, you are how old again? You are 25? Okay, so from 25 to 35, we have a package that will cost you X amount. And then from 35 to 45, we have a package that will cost you X amount. That is definitely a warning sign.
They haven't even seen you.
Yes.
Yeah. No.
They don't see needs. There is no individualized approach. It is a cookie cutter approach. And plus, the biggest concern for me is what you are getting placed into your face, because these injectors are not registered doctors in South Africa, and all the distributors of reputable aesthetic products in South Africa are strictly regulated, and they have to and only can supply to regulated doctors in South Africa. So the products that you're getting is black market products. They are not the real thing. They are not SAHPRA approved. SAHPRA is the healthcare regulatory body of South Africa. And so at the end of the day, it's very scary, first of all, what you get into your face. Secondly, it is also very scary because these people that call themselves cosmetologists and doctors are basically not trained in all the anatomy that I've explained to you. I've just touched the base. The face is really intricate. Doctors that train in this field, it takes them years to hone the skill of how to understand the intricacies of a face and on how to manage the complications when something should go wrong. Now, unfortunately, these illegal practitioners, they do not have a clue on how to manage a complication. And also what we've experienced is that they are very good at just washing their hands. If a patient says something has gone wrong with my lip, I'm uncomfortable, I'm in pain, my lip is cold, my lip is blue, what can I do? They're just happy to say, oh no, this is normal, give it a couple of days and it will settle. And I mean, speaking from experience, this has happened recently to where a colleague of mine had to end up helping a patient that was on the day injected by an illegal injector. By nighttime, she was in so much pain. Her lip was purple and blue, and her lip circulation, the blood vessel, was basically injected, and she had no circulation to her lip. So her lip would have scarred for life, and she would have lost her lip tissue for a very long period of time had my colleague not intervened. But this patient did contact the injector, and the injector said, the illegal injector, and the injector said, no, it's okay, it's normal, we wait, give it a couple of days, it's just swelling, it will settle. So they don't know how to identify a complication, and they do not know how to treat a complication should that happen. And they're very happy to just say, oh no, it's normal, and then, wash their hands. So there is there's no recourse for them, because it's unfortunately. So I feel like I feel firstly very strongly about it because it's exploiting the public. It's not in public interest of the health and safety. And thirdly, a lot of them are just illegal. They're not even allowed to work in South Africa, but they somehow take chances. So just be on the lookout for those kind of warning signs. I'm very vocal about it because I feel like I'm a doctor. It is my responsibility to warn the public when we see these things. And you don't know what you don't know. Some people are just like, they didn't know. So those are the things to be looking out for. And of course, AI generated stuff, it's easy to spot AI generated stuff. If a patient has pigmentation on your before photo and absolutely no pores on the next photo, then you know that that's an AI generated photo. So, yeah.
Wow, that is shocking. Okay, perfect. So we're going back to that previous subject. I wanted to know, what is the difference between skin boosters, Botox, and fillers?
There's a big difference. So can I take things out to show you?
Yes.
I'm not going to show any brand names, but I want you just to understand. Okay, so Botox is this little thingy. Okay, and Botox comes in this little fluid. Okay, so it's a little fluid that we inject into muscles where we want the muscles to relax a little bit. Like muscles that causes negative expressions and causes like a little bit of a negativity in the face. Muscles that make you look angry, sad, that sort of thing. So we use it in muscles mostly of facial expression. We use it in the frown area because the frown often makes you look sad and grumpy or angry. So this is what botulinum toxin, that is what it does. It helps to relax muscle of facial contraction, where it can over time make you form these deep wrinkles that will be then later in your life difficult to get rid of. So that's that. Then, and it comes in like a little box like this, and we mix it into a fluid and then we inject it. Then skin boosters, you get two types of different skin boosters. You can get skin boosters that you just inject with your hand nice and gently, superficially, and it will last you for a good 3 to 4 months, and it gives you nice hydration. This is one of them. Okay, and it is it's a solution that we inject with hand, or you can also use an injector device, and it gives you a very nice glow and hydration, and it also has nutrients in the skin. So it's like infusing your skin with vitamins, nucleic acid, amino acids, hyaluronic acid, all the nice things that gives you that glow, right? And then we also, you get different types of one. Then we also have the skin boosters that last a little bit longer in the skin. So you can inject this and then you'll have like a good 9 to 15 month result, depending on which product you use. And then you asked about a filler. So a filler is completely different. A filler we put into that, remember those deep structural things you were asking about? We use a filler, it looks like this, it comes in a gel form. We use this to give structural support back into deeper layers of the face that have aged, as well as re-inflate tissues that have deflated. So we can use fillers to give structure. We can give fillers to add support where structures have aged. We can use fillers to reflate little tissues that have deflated. We can use fillers to help with profile balancing. We can use fillers for subtle enhancement, let's say in the lips, the nose, the chin, where we want structural support. But fillers, in my mind or in my hands, is not used to inflate a face. It's for structural support in the areas where the structures are changing and where they are aging. So that's the difference. It's completely different. Fillers does one thing, and botulinum does another thing, and skin boosters are like, we're treating the different layers. We're treating the skin layer itself. This goes deeper. The fillers go deeper. The skin boosters go a little bit more into the skin, and then the botulinum toxin goes into the muscles. So I hope that makes a little bit of sense. Does it make sense?
More clear. Yes.
Yeah, and this is again why it's important to first have a consultation so you can see what it is that you actually need. Because you might not need all of it.
Exactly. Okay, and the last question, what is your best, in your opinion, the best anti-aging treatment or advice that you can give?
Right now?
Yes.
What age?
I think as someone, maybe let's do the 40s. Where things start really happening.
40s. Like in our 40s, we start to feel like things are just happening overnight, say.
Yes.
Yeah. But
that's not great.
We have to remember that we don't start aging in our 40s. We already start with collagen loss when we are in our late 20s. But the effects we only really see when we get to our 40s. And then in our 40s, we also have hormonal changes kicking in, and we get to see all of that kind of thing. So my approach to a 40-year-old would really be to look at, just from an aesthetic point of view, to look at, again, structure. Do they have volume loss? Are they sagging? What is their skin quality like? I love to start if it's a first-time patient, I love to start with collagen stimulation. Collagen stimulators, regenerative collagen stimulation. And the reason for that is because when you reach your 40s, you have already lost about 10%, 10 if not more, 15% of your collagen by the age of 40, if we go at the rate of 1% per year from 25 years onwards, right? So then what I tell my 40-year-old is to start with collagen stimulation. It will really help to tighten your skin again and almost tuck you back in a way. Because what we find is like 40s, you kind of feel like you're falling. Yeah, you feel like this is happening. You feel like,
especially the lower half.
Yes, if you take a selfie like this, it looks wonderful, but you do it like this, it looks terrible. And it's because we have this repositioning of our tissue, because the lower half. But the lower half is not the problem necessarily. The structure in your mid-face and the structure in your temple and your skin quality is what's causing you to start to see this melting sensation, this sort of melting look. So we have to tighten this up and that up in a 40-year-old so that they don't sag further. And collagen stimulation also then for me, it's about banking your collagen for what is to come. Because we know that in your 40s, you know that there's going to be changes happening with your hormones. You know that there's going to be at some point when you're in your menopause, you're going to have an estrogen drop. When you have that estrogen drop, you lose your collagen even more. So we kind of want to bank your collagen for the future. So I call this a skin investment. A lot of people, or collageneration is like new collagen that you regenerate. And what is beautiful about it is that you're using your own body's mechanisms to stimulate collagen. It's not like you using anything else. We're just injecting a collagen stimulator. We're putting a message into the skin to say, hey, there's something here. Please come out, you little fibroblasts. We need you to come work. And then they work into the areas where we want them to work. And then they work for 3 months continuously. And then after that, you have a beautiful result for 2 years long before you will need to do a restimulation. Yeah.
That's amazing.
This is why I love in a 40-year-old to start with collagen stimulation, where we get that collagen up. And then if you need volume, a little bit of volumization, then you do the volumization at the same time, or depending on how the patient would like to structure it at that point in time. But I like for a 40-year-old to have a nice long-term plan. So collagen regeneration for me is, and this is why it's, for me, this point in aesthetic medicine that we are in is such a beautiful turning point, because everything is going to be more regenerative, natural. It is no longer about, like, I've never been a fan of the pillow face and overfilling a face and people starting to look all strange, and I've never been a fan of it. And this is why it's so exciting for me right now, this very time that we are in, is that for the last 2 to 3 years in aesthetic medicine, we're taking this whole regenerative path where we're using our own body's mechanisms to stimulate regeneration of tissue. And that's what I love. So, and this is where skin boosters are so helpful, and this is where collagen stimulators are so helpful, and things like exosomes are now also, like the new buzzword on the street, and polynucleotides and all the nice regenerative things, PRP, platelet-rich plasma. There's so much out there. We can really custom make a plan for our patients. This is why I ask, like, what age are you talking? In your 20s, I would say skincare. Really, really just focus on skincare. And if you want to come in your 30s, definitely also just keeping your collagen healthy. Do things like microneedling, dermapen. We custom make things so that address your specific concerns with your dermapen, skin boosters, all that in your 30s, but definitely collagen regeneration in your 40s, and structural support with fillers together with that. And then as we age, we see what we need. Yeah.
Yes. I love to hear all of this. I think it's so important because you begin to understand better the more detail you give us. Okay, perfect. Are there any collabs or anything like that coming up in the next 3 months, events, anything like that?
There's lovely, I can't say too much, but there's definitely an aesthetic event, which is very exciting, coming up in Cape Town. And then we have a few lovely events coming up in Johannesburg as well for dermatologists and aesthetic doctors to attend. Collaborations, not so much at this point in time, but I am going to have on my Instagram feed, I am going to be talking to a few of my colleagues who I really trust and admire. They have very similar passions to mine, but their niche is in other avenues of aesthetics. But I really would like my audience to also be exposed to that. Yeah, and other than that, just, I'm just trying to live a balanced a healthy lifestyle. It's hard to keep all the balls in the air. Most of the exciting things are the congresses that are coming up. And for me, I'm also studying in the background. I'm doing a course. I also can't say too much about that now. I'll talk a little bit about it later.
I just wanted to check contact details. Obviously, you're very active on Instagram, website. If someone wants to get hold of you, I think website and Instagram are the best. Your phone number is there too.
My Instagram handle is Dr Hilla_AAA, is for Aesthetics Artistry Aligned. I am based in Century City in Cape Town. And our website is doctorhilla.com. Telephone number is 072-400-1635, and we are open to having any WhatsApp conversations.
Perfect.
Yeah, that's where you'll find it.
Thank you so much for joining us today. It has been so insightful. Very insightful.
You're welcome, Kat. I hope you I hope I was able to add some value.
Definitely.
Thank you for having me, and thank you for the invitation.